Our next speaker is a public health physician and an urban epidemiologist. She's clinical director of research at the University of Cambridge and founder and principal of Urban Better. She's also an extraordinary professor in architecture at the University of Pretoria and honorary associate professor at the University of Cape Town. She works across policy, private and civil society sectors, designing planetary health into the fabric of rapidly growing cities. Please welcome Tallulah Oni.
Good morning, everyone. Good morning, everyone. Okay, I like to feel connection with you. So I'm going to be talking about transformative action for building healthy, climate-resilient cities. And when I talk about transformative action, the word exigence comes to mind. It's a nice word, exigence. It's from the Latin word for demand. It's that thing that gives us the oomph, right? So that sense of urgency, that inherent pressure to do something about a situation immediately, that critical component, right? So that ignition in the engine that really says it's time to go. So I'm going to be talking about where I'll share with you some of my exigence points. So what lies beneath my exigence covers, as it were. And then I'm propelled by these internal drivers, what I believe are the three critical exigence pathways for transformative action for healthy, climate-resilient cities. So here are my three, getting under the exigence covers here. I'm a physician, so I have a vocation trained in the art of talking, of diagnosing, of trying to heal, of treating, or in the context of a complex adaptive system that is the human body. And you heard from the previous speaker really how complex our bodies are. So that's one aspect I'm driven by, just wanting to diagnose and to treat and to improve the state of health. The second is I'm a researcher. Right, so that is really getting behind, yes, we have this issue, but why? What are the critical drivers? How do we go upstream and how do we prevent? Does that work for everyone in the same way? Or what are the ways, what are the interventions that we can implement in order to improve health in whatever setup I work in? And the third is I'm a runner. And this is important because I'm regularly engaging and interacting in public space. And a lot of actually my exigence and that kind of drive for transformative action for healthy climate-resilient public spaces comes from a personal experience of navigating what it is like to run in different parts of the world. And I'll come on to that in a moment. So these are the three threads really that drive my desire to health-proof the future of cities. Why cities? Well, we know that apart from the fact that the vast majority of us are now living in cities, so over 70% of the world is living in cities, and this number is growing rapidly. But from a climate perspective, the majority of greenhouse gas emissions is also coming from cities. Why rapidly growing cities? And Lagos is the star of this particular show because he started it. I'll just pick it up. We know that most new urbanites will be living in Africa and Asia, where we have these interlocked vulnerabilities of health, climate, land use, and pollution. Particularly focused on Africa. It is the fastest growing region globally. The number of African cities with more than 500,000 people is estimated to increase by 80% by 2030. Do you remember when 2030 was a really long time away? Yeah. It's also a very young population. It's the youngest continent. The median age is just under 20, compared to Europe, where the median age is over 40. Right, so bear that in mind when I talk about one of the pathways of exigence I'll mention earlier. But really critically, and you heard from the previous speaker about these cities being built, but the vast majority of investments in these spaces are yet to be made. So the opportunity and the need for this exigence and this transformative action is really critical because we're shaping it now. And there's an opportunity to actually create the future that we aspire for. And I ended up in the kind of interconnection between health and climate really from a perspective of future-proofing health. Because I started realizing that in the cities where I work, and this range from, I was born in Lagos, I live in London, live in Cape Town, work across the African continent. The same environments where we needed to shape public space for health, I started realizing that we couldn't really design interventions without thinking about health. Otherwise, we were just designing interventions that were not future-proof. So if we're thinking about how to create more walkable cities, where we're not thinking about that in the context of the heat realities that we've already laid down, or the flooding risks, or the air pollution, then we're not actually creating future-proof investments there in our health. So this is how my work evolved into that intersection between climate and health. And I'm not alone. There is a growing recognition of the need to really address these things together. This visualization that looks a little bit like branches from the sacred timeline, the TVA, yeah, you know. What it actually shows is the core drivers of the core health impacts that can be achieved through climate mitigation actions. Now, this report just came out today, and it looked at what existing evidence that we currently have of the health impacts that can be gained from climate mitigation actions. And what it identified was 3 key pathways through which, if we actually focused our net zero ambitions on reducing air pollution through phasing out fossil fuels and replacing with clean renewable energy, through healthier, sustainable diets, and through environments that are supportive of active travel and public transport and reducing car use. Those 3 pathways alone, as climate mitigation actions, have significant positive impacts on health. And these are near-term impacts, by the way. Sometimes we talk about climate change as this thing that's happening at some point in the amorphous future. We know, for example, that addressing air pollution drastically increases or reduces the risk of conditions like heart attacks and strokes over a couple of months period. Right? So this is not a long-term thing. These are short-term, near-term benefits from tackling this. Another example of integrated action, this report was launched at the UN General Assembly this year, recognizing that we're also 7 years from the Sustainable Development Goals. There are things like air pollution, again, is a Sustainable Development Goal related to health, also related to sustainable cities, but again has this overlap with climate. I talk about air pollution a lot because it's actually the most obvious point of intervention, especially when you're talking about public space. It shares common sources with greenhouse gas emissions. You have this benefit with health, et cetera, et cetera. And lastly, another example of integrated action at the global policy level, the World Health Organization annually reviews, so countries voluntarily report their progress towards the Paris agreements with these nationally determined contributions. And what we found is, and this is a bright spark, that over time, and this most recent one this year, over 90% of reports actually mention health as a core part of climate action, which is a phenomenal improvement. However, the vast majority of them don't actually measure it. So we're starting to recognize the importance of it, but we're not actually taking that next step into measurement. So again, the need for transformative action. So those are some progress markers, but some barriers to action still exist. the one really critical barrier, so I had the word resilience in my title, resilient cities, but I actually struggle a little bit with that word because there is often a sense of there's nothing we can do, so you have to be resilient, right? But what happens when a lot of the shocks and stressors that we see play out in cities are the direct impact of intentional choices? Should we just wait until that plays out and be resilient to the intentional choices where we could have made better choices? So I think that's a really critical barrier to action. We have a bias towards responding. When I say we, I mean our species. We tend to perceive emergencies when they're right in front of us, and we respond and we act and we say, yes, we've done something about it. But when we have the slow motion emergencies, we tend to respond a little less vigorously, shall we say. The other barrier that I've identified in my work is the separation between exposure and outcome. So the example I usually give is, can you imagine if the pandemic, with the COVID pandemic, if the SARS-CoV exposure to the SARS-CoV-2 virus today in London resulted in poorer health in Germany next month? Would we have acted so quickly? Very unlikely. Because what gives us a sense of urgency is we can connect the exposure to the outcome. It's short term. I can say, okay, I went out there, it was crowded, a couple of days later I fell sick. We can see what to do. But the challenge with these complex challenges that we face around climate and population health is that often the exposure and outcome are separated in time and space, in different sectors. So you have entire developments of a whole new part of the city built, that actually results in a rise in asthma of children, that result in poorer lung health within a few weeks or months, but that's felt in another sector. So when we start thinking about transformative action, I spoke last year at the Wired, the health event, and I spoke around the need to rethink health, so rethink health beyond healthcare, into thinking about all of these exposures that influence health. We know over 80% of factors that influence health lie outside of the healthcare, and yet when we often think about health and improving health, we think about healthcare. Doesn't make sense, right? It makes sense to actually protect health and create health rather than just treat disease. I spoke about the need to reimagine cities as critical health infrastructure. What if we saw cities not just as the buildings and where people congregate, but actually an opportunity to create health by actually designing the fabric of those cities for health. And I spoke about the need to reconsider innovation beyond just the gadgets to actually the social contract between people. I will add to it this time the need to react transformatively. And what do I mean by that? So earlier I mentioned about the three drivers. So you're going to start seeing the practitioner in me, the researcher in me, and the runner in me, and how these have come together into identifying these three critical exigence pathways that I believe we have to ignite for transformative action. This is the researcher. We need to do better. Are there any researchers in the room? Show yourself. We need to do better. Whatever we do, the pace that we're working now was for a different time. When we talk about transformative action, we can't do just more of the same type of research. We have to do better. And I believe certainly the research I do, which I'll tell you about one aspect in a moment, a really critical part of it is needing more embeddedness, needing more nimbleness, needing more engagement with people in order to generate the evidence that we need. And that requires that we embrace complexity, we embrace discomfort, we shed the skins of our disciplinary training, and that we embrace new ways of knowing and new ways of doing. So a key area of focus for my research is on built environment, health, and equity. And what you can see reflected in these three pathways are the pathways I showed earlier on the sacred timeline around the pathways through which health, climate mitigation interventions can improve health. So through the air we breathe, through our places and spaces, and the food we eat. The air we breathe. Air pollution is responsible for, outdoor air pollution alone is responsible for over 4 million deaths a year globally. We have at the moment a situation in Delhi, for example, which is this annual air pollution event, where already in a couple of years ago, just in 1 year, air pollution was responsible for over 50,000 deaths. And if that sounds like a long way away, in the UK, that number is over 20,000. Does it make sense when we talk about being able to, oh, we can't afford to? Can we afford to ignore this? Can we afford to ignore the reality that, say, on the African continent, which is the youngest population, which is fastest urbanizing, where you have 16% of global deaths from air pollution. It's the second highest cause contributor to premature mortality on the African continent. More than diarrhea, more than HIV, more than tuberculosis, air pollution. It costs, in Lagos alone, over 3% of its GDP in 1 year. Going to places and spaces, a built environment. So this is a little bit of running meshed up in there. We did this work in Lagos and Yaoundé. We wanted to understand how people use public space for physical activity and what health risks they encountered. One of the things that we found was that in higher income areas, people were more likely to have more conducive public space for physical activity. We're more likely to be able to be physically active individually because it was safer, and conversely in lower income areas of these cities. We found that even though people were embracing this healthy behavior, they were confronted with these health risks. So rather than just saying people need to be healthier, how about we start actually making these environments more conducive and make physical activity a much more rational choice, whilst, of course, contributing to climate mitigation. And lastly, the food we eat. I consciously didn't label that, but if I said the purple was good, and that's lots of fruit and veg, and the yellow, the orange, was a lot less fruit and veg. One side is richer areas, one side is poorer areas. This is work that's being conducted in several cities in Africa and the Caribbean. Which side would you hypothesize is the richer area? It shouldn't be this obvious. But this is why evidence matters. We have to better connect exposures to health behaviors and outcomes. We have to better understand how to tailor public health messaging to, so for example, I went running in Lagos and we have air pollution issues, but after the rain, I run with an air quality monitor. After the rain, the air quality is cleaner than in London. So how can we actually tailor our messaging better to say, okay, maybe you should go for a run after the rain, etc. Number 2 is precision activism. So this comes from my running, right? And recognizing that it shouldn't be this difficult. You could go for a run in a city you don't know. You know instantly when you've got to the posh area, and you know instantly where you've got to where you're running through the dodgy area. Why? The leaves, the greenery, the heat, just the pavement and how easy it is to run, the air pollution and how easy it is to breathe. So I started running with an air quality monitor, and I started realizing this, and I thought, well, how can we actually leverage this if we put this technology into the hands of people, if we democratize science and actually rethink what it means for civic participation? And how can we, beyond thinking about evidence just for research or just for policy, how can evidence actually be used to tailor activism? This is what we call precision activism. So leveraging that physical activity and the potential of citizen science, but also technology. So what we did was last year, and this is a project that is now ongoing, in Lagos, in Cape Town, in Accra. We recruited the majority demographic, a sample of the majority demographic, which is what I call youth on the African continent, because they're not a niche group, they are the majority. We recruited people who are runners. We equipped them with wearable air quality sensors and an app that we designed to allow them to capture information on health risks or climate risks they encountered whilst running. They integrated those data afterwards, and they use those data to tailor the activism, to say, okay, what did we find, and what are the key messages here? So one of the key things they realized, for example, was that air quality wasn't being measured. Lagos is a city of over 20 million people. We weren't measuring air quality. We cannot change what we don't measure. So they tailored their activism and their campaigns based on the data they generated, mobilized hundreds of people across the city, and had a social media campaign that they took to COP27 in Egypt last year. They wrote a prescription, so this is like the medical side of things, what I call a policy prescription based on that to say, this is what we found, this is what we think needs to happen, and a really critical part of that is involving that majority demographic in decision making. They ran and measured the air quality in Egypt and showed that the connection with construction areas, etc. This was featured. This was one of the citizen scientists who then did a marathon in Lagos a few months later, ran the marathon with an air quality monitor when the roads were closed, ran the marathon again 4 weeks later when the roads weren't closed to generate his own data to understand and to push to show what the impact was. And interestingly, one of the things he found was that obviously air quality much better when the roads were closed, apart from an area where there was a lot of smoking of food going on. So that potential to harness that majority demographic that is actually very keen to effect positive change, to use something simple as citizen science and digital technology to actually generate their own information is absolutely critical, and we have to do this at scale. And the third is participatory decision making. This brings me to my practice. So as a physician in medical school, we talked about the body as this complex adaptive system. So I talk about now the cities and my patients, right? And a city is a complex adaptive system. You have these interconnected components, they're like little organs that have their own system, they interact, and you have this emergence of different issues. And we know that we cannot understand the whole system by looking at the individual parts. We have to understand how they connect. So this transformative action is a chemical reaction, right? We have to engage people in order to understand what those moving parts are. Too often, we have the situation where decisions are being made by the minority without engaging people. So one of the approaches that we took, this project that we had, where we then raised some funding to deploy sensors, air quality sensors across the city in Lagos, and we said, well, yes, we're going to do that. We'll deploy the static sensors, but we're going to define participatory air quality management in two ways. One, we'll get the citizen scientists to augment the static sensors with this dynamic sensing so they can actually generate additional information to better understand where the sources of air pollution are, but also to hold accountable decision makers. It's like, well, you said you were going to do this, we went for a run, we generated information, well done, you did that there, but you didn't do that there. So that rethinking participation, rethinking civic participation. So we had this workshop, and right from the perspective, right from the point of deciding where the sensors go. This would normally be something that the government decides. And we said, well, no, there are different types of expertise. Yes, there's academic expertise. Yes, there's government expertise. Yes, there's civil society expertise. Yes, there's runner expertise. Let's get everybody together, share your expertise, and actually tell us where you think the key areas to measure are. And what we saw, well, what emerged was completely different from what anyone thought going in. I'm going to take a tangent to close off. In 2020, UNEP, the UN Environmental Protection, Environmental Program, launched a report that found that between 2015 and 2016, African countries imported the largest number of used vehicles. And yet most of the countries had limited or no regulations. A couple of exceptions, Kenya, Mauritius, but had little policies around importing of vehicles. And you think, well, okay, we need better regulation to clean up the air. But here's the thing, and this is the last point I want to make. In the same year, the Netherlands, and I'm just picking out the Netherlands here because it's not by any means the only, it was just in the report, they set out an ambition to cut greenhouse gases by 60% by 2030. Very, very laudable, incredible. And yet in the same year, 80% of the vehicles they exported to West Africa did not meet the Euro 4 standard. And most of the vehicles didn't have valid roadworthy certificates. So tell me, are these two different planets that we're working on? How do we locally make some policy that is very laudable, but export or seem to export the problem elsewhere? We saw from heat, we saw from air pollution, this knows no boundaries. So when we're thinking about this transformative action, be that around embedded research, be that around participatory decision-making that is engaging the populations, be that around precision activism that is democratizing science and rethinking civic participation, it's really important for us to remember that health and climate risks are transboundary and long-acting. And so we need to be far-sighted. We need to be evidence-informed. Yes, we need to be acting locally and be locally rooted. But ultimately, if we are going to be transformative in our, and actually effective in our desire to create healthy, climate-resilient cities and a healthy, sustainable planet, we're going to need some coherence. And this action is going to need to be globally connected. So that's where I want to end. I hope I've shared with you some of what drives me in terms of my exigence points. And if healthy, climate-resilient cities are not your thing, I don't know why, I hope at least some aspects of this resonates and that you're able to identify where your exigence points are. And in the spirit of this event, for you to be more effective in your sphere of influence to effect positive change in society. So with that, I thank you.